Welcome to Module 1 of a 3-module accredited training for pharmacists and pharmacy technicians focused on harm reduction practices in community pharmacies. This training is funded by a grant from the National Institute on Drug Abuse to the University of Arizona's Dr. Beth Meyerson. I am Dr. John Agley, an associate professor at the Indiana University School of Public Health in Bloomington. The research team also includes Dr. Nina Vadai, a clinical assistant professor of pharmacy practice and science at University of Arizona's College of Pharmacy, Dr. Beth Meyerson, a research professor and the principal investigator of this grant, director of the Harm Reduction Research Lab at the University of Arizona College of Social and Behavioral Science and College of Medicine, Dr. Keith Bentley, associate research professor at University of Arizona Southwest Institute for Research on Women, or CIRO, Dr. Richard Crosby, endowed professor, University of Kentucky College of Public Health, and doctoral candidate Danielle Russell, Arizona State University. We look forward to your feedback about this training and hope that you enjoy the learning experience.
Hello, everyone. I'm Dr. Beth Meyerson. Let's begin by seeing what you already know through a series of questions. We will revisit these questions at the end of the training. They will be automatically presented to you. Let's watch a pharmacy interaction that could be happening in your pharmacy or one in your community.
Oh, hi. May I have your name? Are you picking up a prescription?
No, I'd like to buy a bag of 10 syringes.
May I ask you what they're for? Do you have a prescription to fill today?
I don't have a prescription. I need them so I don't get HIV or hepatitis.
Okay, well, we don't want that either. Are you on a medication that requires syringes? Are you taking hormones, for example? I need a prescription of some sort in order to sell them to you today.
Well, I don't have a prescription, but I didn't think that I needed one to get them in pharmacies in Arizona.
Well, our store requires that you have one.
Can you not help me then?
Well, just don't share syringes and get tested regularly for HIV or hepatitis C.
Hi everyone, this is Dr. Keith Bentley. Let's take a moment to define some terminology. Substance misuse is using a substance for a purpose other than what it is prescribed for. This may be purposeful or unintentional. Substance use disorder, SUD, a chronic neurobiologic disorder affected by genetic, psychosocial, and environmental factors. Individuals with an SUD exhibit compulsive behavior, continued use of a substance despite harm, cravings, and impaired control. Harm reduction is a philosophy expressed in practices that seek to minimize the health consequences of high-risk behaviors such as drug use.
Hi, I'm Dr. Nina Vadai, a pharmacy researcher in Arizona. Our Arizona-based studies have found that pharmacies are an important position to protect the health of patients and communities through harm reduction services. Examples include dispensing and counseling about naloxone and/or safe injection and disposal. Other harm reduction services performed at pharmacies include dispensing treatments for opioid use disorder and selling syringes without a prescription. Pharmacies can also consult with their patients about sexual health and pre-exposure prophylaxis to prevent HIV. All of these services reduce harm for our patients, and many of them are revenue generating for the pharmacy.
Hello everybody, my name is Dr. Rick Crosby. I will be talking with you about the model that you see in this slide. So the key principles of harm reduction are straightforward when thinking about patient-centered or empowerment-centered care models. We will walk through briefly these principles, and I will provide you with examples. So we begin in the upper right corner. Individuals are treated with dignity. Such an important principle. We probably believe that we always treat patients with dignity. But the fact of the matter is that that may not always be the case, especially when we judge them for their health behaviors or their health decisions. In the case of drug use, an Arizona-based pharmacy study found that people were often judged or mistreated at Arizona pharmacies when trying to purchase syringes to protect their health.
Hi everyone, I'm Danielle Russell. I'm a PhD candidate and researcher at Arizona State University, and I'm part of the Harm Reduction Research Laboratory with Dr. Meyerson. When we consider personal responsibility, we often think about it in terms of people taking care of themselves the way they believe is important and accepting the outcomes of their decisions and choices. However, some pharmacists and technicians may not believe that people asking to purchase syringes at pharmacies for their drug use are seeking to protect themselves and taking personal responsibility. What we do know is that purchasing syringes to prevent infection and tissue damage is actually a way of acknowledging responsibility and working to reduce the harm that their behavior may cause to themselves or others. This video shares a story that is a compilation of many stories we hear in our Arizona-based research. As you listen to Sue's comments, please identify where your beliefs may conflict with what you hear. Write these beliefs down and consider them as we progress through this training.
My challenge is to access sterile syringes to prevent HIV, hepatitis C, and tissue damage. I'm glad we recently passed a law decriminalizing syringe possession, and I know pharmacies have been able to sell them without a prescription for a long time. This gives me comfort knowing that I can go into my local pharmacy and purchase a bag of syringes and some naloxone. But I also know that not every pharmacy sells them without a prescription. This creates a huge health risk for me and many pharmacy patients throughout Arizona. It is so stressful that there's no consistency among pharmacies. I often have to drive to several pharmacies, and I'm surprised to find that sometimes pharmacies that have sold to me in the past wouldn't do so consistently. It's so stressful going into several pharmacies wondering if I'm going to be able to purchase a bag of syringes to maintain my health. Plus, the pharmacy staff makes me feel like I'm not a pharmacy patient or customer. They make me feel like I shouldn't exist at all.
So moving now in the model down to the lower left quadrant, individuals have a voice in their own healthcare. This means that people have autonomy, that they have agency when it comes to their own health decisions, their own decisions in life, including healthcare decisions, and all of the related services. So, in the words of one pharmacist,
the key for us is not to have predefined outcomes or goals for others, especially for our patients. For example, a patient that approaches a pharmacist with an interest in smoking cessation will receive much different counseling than someone who actively smokes and state they are not interested in quitting. The philosophy of harm reduction teaches that people get to choose their goal, but even in the context of a goal having been chosen, people are at different stages of readiness, willingness, and ability to pursue that goal. We as pharmacy staff must understand that this is to better serve our patients. What does this mean? It means that a patient's decision to continue to use illicit drugs is accepted. Our role in the pharmacy is to help them reduce harm to themselves and harm in the community through the spread of bloodborne illnesses associated with injection drug use.
So we move now to the final quadrant, the upper left of the model. It's reducing harm, not consumption, is the goal. In our society, many people believe that the only way to prevent harm from drug use is to stop using drugs completely. This translates to having the goal of reducing drug consumption. However, when that is not possible, the goal becomes seeking treatment for substance use disorder. Many patients may not have this goal, which is a reality we must accept. The goal of harm reduction is not necessarily to help patients stop or reduce consumption, although that is one potential outcome. Instead, the goal of harm reduction is to support the reduction of harm through actions that are based on the agency and the decisions made by patients, no matter what our own personal values may be.
Now that you have had the chance to learn a bit about harm reduction and the potential for services in pharmacies, let's take a moment to consider myths and facts. We will present a statement and then ask you to select whether it is a myth or a fact. We'll ask you about 4 of them. Harm reduction just encourages people to use drugs. Is this a myth or a fact? This is a myth. Here is what we know from studies conducted in the United States. The sale and distribution of sterile syringes has not been shown to increase the number of people who inject drugs or to increase drug use. Here is a statement from a pharmacy patient as was reported in our Arizona studies. People know what their health needs are. If I'm purchasing syringes, it is because I want to be healthy. I'm going to use anyway. Why should I be denied the chance to take care of my health just because I use drugs? Here's another myth or fact. Selling syringes will increase the number of discarded syringes in the community. Is this a myth or a fact? This too is a myth, but it is commonly held. US studies have shown that pharmacy syringe sales do not increase the number of discarded syringes, especially when disposal options are available. In fact, opportunities, such as in pharmacies, to purchase and properly dispose of syringes decrease the prevalence of community discarded syringes.
Harm reduction neither condones nor opposes a health condition. Instead, it is focused on facilitating the specific risk reduction behaviors that people have indicated they are ready, willing, and able to take right now. Myth or fact? This is a fact. There are many health conditions where we employ harm reduction approaches. Here are 2 examples. Smoking cessation. We now treat nicotine use disorder with medications. This practice demonstrates that medication is more effective than our historic approaches of cold turkey quitting. Diabetes management. People who live with type 2 diabetes are often blamed for their condition, even if they try to manage it with behavior change and medication. Our health system understands this and therefore provides avenues for health that are based on harm reduction principles so that patients are treated from where they are now or currently versus where healthcare professionals, including pharmacists, want them to be.
We sell syringes to patients without a prescription at my pharmacy. We usually don't ask why they're needed. We feel that it's better to dispense sterile syringes than to deny patients access to them because we want to help prevent or minimize the risk of infectious diseases such as HIV or hepatitis C within our community. If our customers inject drugs, they're likely going to do it whether we sell them syringes or not. This is because they will be very sick otherwise, especially if they are not ready for or can't access substance use disorder treatments. So we prefer to sell sterile syringes upon request to help our customers keep themselves and their communities safe and healthy.
Myth or fact? People would not face stigma if they were in treatment for their drug use. This is a myth. Studies have shown that stigma is centered on the person who uses drugs and the history of drug use. People who are on medication for opioid use disorder are often stigmatized because of beliefs that the mat replaces one drug with another and is not sobriety. Intervention stigma marks providers and patients involved in a particular form of medical treatment. In a 2021 study by Burgess et al., pharmacists and pharmacy technicians were identified as the most frequent promulgators of discriminatory or stigmatizing interactions with people who were on medication for opioid use disorder, as well as with providers who called in prescriptions.
Hi, I'd like to purchase some naloxone.
Okay, let me go get the pharmacist. They can go over that with you.
Thank you.
Hey, there's a patient who needs some naloxone.
Okay, thank you. Hi there, how can I help you?
I'd like to purchase some naloxone.
All right. Have you been trained on how to safely use naloxone?
Yes, my doctor showed me how.
Perfect. We do have the intranasal naloxone. Is that all right?
Mm-hmm.
Perfect. I will bring that up for you. Is there anything else I can do for you today?
Yeah, actually, could I buy a bag of 10 syringes?
Of course. What size?
Half-inch needle, 29 or 30 gauge is fine.
Okay, I'll have the tech confirm that they are in stock, but we do usually carry them. Do you have a safe way of disposing the needles?
Yes, I have a sharps disposal container at my house.
Perfect. I'm also going to provide you some resources in our local community. We have a local syringe service program that provides naloxone and syringes for free.
Wow, that's great. I'll still probably continue to purchase them here since you're closer to where I live.
Wonderful. Please be sure to use a sterile syringe each time you inject when using, okay? Have a great day.
The learning objective for this section is to increase awareness about how U.S. pharmacies offer harm reduction services. You have already heard about a few of them in this course so far. So let's take a quiz together.
In studies conducted worldwide between 1995 and 2011, the most common harm reduction pharmacy practices included selling syringes and dispensing opioid replacement therapy, or ORT. Pharmacists were most comfortable with ORT dispensing. The answer to this is yes. State laws allowing standing orders for naloxone dispensing have been associated with an increase in naloxone stocking and dispensing by community pharmacies. These laws have also been associated with decreases in opioid overdose mortality. Every state has enacted some form of naloxone access law, but because of continued access challenges paired with continued increases in opioid overdose deaths, primarily due to fentanyl, the FDA is considering making naloxone an over-the-counter medication. Barriers at the pharmacy level include inconsistent stocking of naloxone, lower availability of naloxone in independent pharmacies as compared to other community pharmacies, less availability in areas with economic insecurity, and lower availability in rural areas.
True or false? Pharmacists are not often asked about selling syringes without a prescription. This is true. A majority, 68% of pharmacists in one state, Indiana, reported that they had been asked to sell syringes without a prescription in the past 2 years for likely injection drug use. A recent 2020 study of Arizona pharmacists found that 74% had been asked by people who inject drugs to sell them needles or syringes without a prescription. This suggests a strong unmet need. But there are barriers. Pharmacist and pharmacy technician refusal to sell syringes without a prescription was a universal experience by Arizonans trying to purchase them to protect their health. 3 types of experiences reported included experience of judgment and discrimination by pharmacy staff, feelings of internalized stigma, inconsistent sales outcomes at the same pharmacy or chain, and therefore decisions to reuse or share syringes for wellness in lieu of pharmacy syringe purchase. Nationally, about half of community pharmacies sell syringes without a prescription to people who will likely use them for injection drug use. Syringe sales were strongly correlated with pharmacists' belief about the benefit of syringe sales and their comfort selling them. They were most comfortable when working at pharmacies that sold them. In Arizona, this number is 39%. Arizona pharmacists who are comfortable with selling syringes to people who likely injected drugs were more likely to do so in practice.
A 2019 study of Arizonans who injected drugs found that nearly all of them had experienced refusals by one or more pharmacies to sell them syringes or needles. The predominant perceptions among people interviewed about these experiences are shown on this slide. There were feelings of being judged negatively for their addiction. People felt discriminated against based on their addiction, and there was a sense of internalized stigma, also known as shame, from being rejected. In Arizona, things are even more dire. In our 2020 study of Arizona pharmacists, we found that only 39% sold needles or syringes to people who did not have a prescription and likely injected drugs. This meant that 61% of pharmacies are not meeting a tremendously important public health mandate for Arizona. Together, we have an opportunity to meet health needs and help Arizonans eliminate hepatitis C, reduce HIV, and bloodborne illnesses. So now let's ask and consider, on a scale of 1 to 5, 1 being not at all comfortable, and 5 being completely comfortable, how comfortable are you selling syringes without a prescription to your patients? Now, many pharmacists believe that they can and should offer their patients a variety of services. For example, 80% of pharmacy managers in Indiana believe that their pharmacies should offer new services to help reduce opioid overdose and addiction among their patients. Now, we understand that there are many challenges to offering expanded services to our pharmacy patients. Expanding services is not always easy. Community pharmacists in Indiana, for example, reported challenges to fulfilling their role in reducing opioid overdose and addiction. And these challenges often pertain to pharmacy structure and operation, lack of patient or provider clarity about the scope of pharmacy practice, and pharmacist perception that there is no available discretionary time to support additional services.
Pharmacists and technicians have known for a long time that pharmacies are often the only place people go for health advice. In rural areas, this is primarily because healthcare providers are inaccessible, but it also may occur because the pharmacy staff are trusted in the community. Pharmacies are important backstops for the public health system for reasons such as vaccination, health behavior consultation, and medication monitoring. The importance of the pharmacy as a healthcare partner is significant. Pharmacies across the country are considering expanding services to reduce overdose, increase access to screening services, and increase referrals to community organizations. However, there are challenges that come with implementing these services. Specifically, Vadai and colleagues have shown that pharmacists perceive communication barriers between patients and prescribers resulting from the retail pharmacy, quote, drive-through, end quote, practice model. Additionally, pharmacists perceive a lack of discretionary time and staff support. The good news is that there are many harm reduction informed services that can be offered without requiring additional staff time beyond the customary pharmacy visit.
I'm a pharmacist in a fairly large Arizona community. Since around 2014, we have seen a huge increase in opioid overdoses in my community. And there have been marked increases in patients asking for syringes to protect themselves from things such as HIV, hepatitis C, or skin and soft tissue damage. Our pharmacy is like others in the community. We are increasingly busy without much relief. This is especially the case during COVID-19. But these pressures are part of being a pharmacy. I became a pharmacist to help people. I grew up in a small town where my folks relied on the pharmacist for healthcare discussions and consultations. I saw how important the pharmacist was, and I understand the important role we play in our communities. For example, there are kids in my community that would not be vaccinated if I were not allowed to give vaccinations in my pharmacy. I'm sure we have all seen this with the adult populations with the rise of COVID-19. This is why I sell syringes to my patients whenever they ask. I instruct my staff to do the same. No questions asked. We care about patient health and make sure they know it. This is not a stigmatized interaction. Why? Because they are my patients. They are customers in my pharmacy. They are part of my community, and I'm here to help them. I have personally seen how harm reduction practices can save lives. Naloxone dispensing, syringe dispensing, consultation about safe syringe disposal, and dispensing of PrEP to prevent HIV. These are just examples of how we help care for patients in this pharmacy. I'm glad I'm a pharmacist, and I'm here doing my part to improve the health of my community.